So one of the things that we're very proud of here at MedStar Montgomery is our history. And I think at the core is a dedicated team of caregivers who are here to serve others. Just over 100 years ago, we were founded by Dr. Jacob Wheeler-Bird, and as they were beginning construction, they actually had to open early in order to accommodate what was then the Spanish flu epidemic of 1918. I think it's interesting that we started during a flu epidemic, and here we find ourselves at another inflection point with COVID-19. Montgomery County was a hot spot. It was definitely a sprint early on. We prepared for all kinds of different situations. So it wasn't something that was completely out of the blue, and yet there was a lot of learning to do early on. So I think it was invigorating for the team, but it was also quite stressful as we tried to understand the disease and figure out how best to treat it.
We saw our first patient on March 6th and then hit our peak volume of COVID patients on May 6th, which was exactly 2 months afterwards. Everybody on the team, nurses, techs, physicians, physician assistant, nurse practitioners really stepped up. So we had to innovate, and a couple things that we did pretty early on was converting a lot of our regular ED rooms into negative pressure rooms, cutting holes in windows to allow for more frequent air exchange, taking off our cloth curtains and putting paper disposable curtains up, using telehealth platforms to interact with patients when they first came in to minimize our PPE usage. Everyone had great ideas, and I couldn't be more proud of my team.
One of the really impressive things during this was the ICU team. At the height of the pandemic, we had over 60 COVID inpatients at one time. Normal number of beds in our ICU is 12. We were able to expand that to 30 and consistently ran 27 to 28 beds full in April and May at the peak of the crisis. And really out of an abundance of caution, the state partnered with us to put a 10-bed self-contained unit with HVAC and medical gases and a nurse's station and a restroom on our campus.
We were amongst the first sites in this region to provide convalescent plasma to our patients. Early on, the drug remdesivir, which was not available, we were able to provide for compassionate use. Now, the drug has been approved by FDA, and we are currently providing this drug to all our patients with COVID-19 infection. And from the experience of our colleagues in Italy and New York, we realized the potential benefit of tocilizumab. We were quick to implement protocols to use this drug safely and effectively in our COVID-19 patients, and we have seen some positive outcomes. And we were amongst the first facilities in the system to place ventilator screens and IV poles outside the patient rooms to limit the amount of exposure.
So the ventilator, of course, is the last resort. We go to high flow nasal cannula first, which is high amounts of oxygen delivered through nasal prongs. It helps improve oxygenation when the patient's oxygen saturations are low. Sometimes you can avoid going on the ventilator, and we found that patients remain on the high flow oxygen, and we're able to wean them down. So it's really been a very good experience for us.
And over the past few months, as we have seen an exceptionally higher number of Spanish-speaking patients with COVID-19 infections, we now have an in-house interpreter who helps communicate with the patients as well as with their families.
As I think about the last few months, I'm really just grateful to our team of caregivers who have been innovative and fearless and really just showing up every day and bringing the best of themselves. And I think what excites me as we go forward is not just the fact that we have 100 years of rich history to build upon, but that we are really here in the community to take on whatever comes and be able to do that in a way that delivers exceptional quality care to our patients by a team of caregivers that are truly heroes.